Hi, I am Lindsay Belcher, and I am going to talk about Hispanics and their increased risk for developing type 2 diabetes for my health fair project. What is type 2 diabetes and who is at risk? Type 2 diabetes, most commonly associated with obesity, unhealthy eating habits, and the modern sedentary lifestyle. Lifestyle and genetics play the biggest role in the development of diabetes. Um, Diabetes happens when the body either resists or stops producing insulin. Racial and ethnic groups that are more likely to develop prediabetes and type 2 diabetes is African Americans, Hispanic, Latino Americans, and Asian Americans. This is why I chose to do my healthcare project on Hispanics and diabetes, because I haven't really heard about Hispanics Americans being at risk for diabetes. I always have heard African Americans are more at risk. So I wanted to highlight Hispanics for my healthcare project. Some statistics would be from the 2009 National Health Interview Survey. They found that the age-adjusted percentage of diagnosed diabetes among Hispanics 18 years and older was 12.3, compared to the 7.7% among non-Hispanic whites of the same age. Particularly high among the Hispanic elderly, reaching 31.9% and 32.4% for the ages of 65 to 74 and 75 and older in 2011, compared to 20.4% and 18.7% among non-Hispanic whites. 2006 age-adjusted diabetes death rate among Hispanics was 29.9 persons per 100,000. This is 1.5 times higher than that of the non-Hispanic whites, which were 20.4 persons per 100,000. Zhao from Department of Communication at George Mason University stated that this disparity in death rate is particularly striking, given that the U.S. Hispanic population has lower mortality rates for any other leading cause of death compared to non-Hispanic whites. Effect of diabetes on Hispanics would be, as stated on the Center for Disease Control and Prevention website, over their lifetime, U.S. adults overall have a 40% chance of developing type 2 diabetes. But if you are Hispanic and Latino American adult, your chance is more than 50%, and you're likely to develop it at a younger age. Diabetes complications also hit harder in Hispanics. Hispanics and Latinos have a higher rate of kidney failure caused by diabetes, as well as diabetes-related vision loss and blindness. The CDC explained the factors that may be involved in the higher risk. As far as genetics, Hispanics and Latinos have genes that increase their chance of developing diabetes. Diabetes is a very complicated disease. And so the connection isn't clear on that, on exactly what in the genetics is that would cause them to be more at risk for diabetes. Food is another factor as well. In some Hispanic and Latino cultures, food can be high in fat and calories. Also, family celebrations may be involved, social pressure to overeat, and turning down food can be seen as impolite in their culture as well. So that's a factor, as well as weight and activity. Hispanics and Latinos have higher rates of obesity, and they tend to be less physically active than non-Hispanic whites. And some see overweight as a sign of health instead of a health problem. Some barriers of communication, which barriers of communication is another disparity in the diabetes and Hispanics, would be language barriers. Some Hispanics first language of Hispanics Americans, some of their first language is not English. So it may be tough for them to completely understand what the doctor is telling them, and for them to be compliant, which is in tune with health literacy, which if their first language is not English, it would be difficult for them to maybe understand some of the literature and understand some of the processes that are, some things that are happening with them in their situation, as well as medical mistrust. That is a very big effector in the barriers of communication and in the increased risk of Hispanics and diabetes because of medical mistrust. They don't quite trust the doctors. One, that is, again, not really knowing what they're saying. So it would be kind of hard to trust someone if you don't quite understand what they're saying or have someone to translate it for you. How to decrease the risk of Hispanics developing diabetes? Communication. That if English is not their first language, there needs to be a translator or maybe a family member, but more likely someone that's not even a family member would probably work out a little better. Someone there in the office, hospital, someone that can translate exactly what the patient is saying and translate it correctly back to the patient, so they are both the provider and the patient are on the same page. Which will come along with developing a healthy provider-patient relationship and building that trust that, hey, I care about you, and I know that you quite maybe don't understand because of the language barrier, but hey, I'm going to get someone in here and we're going to figure it out for you and get you on the right track, as well as promote healthy lifestyles and a nutritious diet. And that's all I have for you today. Thank you. And this is also my reference page. Thanks.